Hi everyone, today my team and I are going to be doing a presentation on the Watchman FLX Pro, a medical device used to advance stroke prevention and atrial fibrillation. The Watchman FLX Pro device is the latest generation of left atrial appendage occlusion device. It's designed to close off the LAA to reduce stroke risk in patients with non-valvular atrial fibrillation. The medical device holds approval from both the FDA and European regulators for stroke prevention in patients who are unable to take long-term anticoagulants. Traditionally, stroke prevention relies on long-term oral anticoagulation such as warfarin, which is highly effective, but it comes with significant bleeding risks, drug interactions, and adherence challenges, especially in older or high-risk patients. Now that we've identified the clinical gap with anticoagulants, this is where the Watchman device offers an elegant mechanical solution by permanently sealing off the appendage, thereby eliminating the primary source of thrombus formation, while also allowing many patients to discontinue anticoagulants after implantation. Globally, between 2010 and 2019, the prevalence of atrial fibrillation rose markedly from 33.5 million to 59 million. With prevalence continuing to increase due to aging populations, stroke prevention in this group has become a critical public health priority, and left atrial appendage occlusion devices have emerged as an increasingly important tool worldwide. The risk of developing non-valvular atrial fibrillation increases with age and is also elevated by high blood pressure, heart disease, thyroid disorders, obesity, sleep apnea, diabetes, excessive alcohol consumption, and a family history of AFib.
The left atrial appendage is the primary site of thrombus formation in atrial fibrillation, as ineffective atrial contraction leads to blood stasis and clot development. These clots can embolize to the brain, making the LAA the leading source of cardioembolic stroke and a major contributor to stroke-related morbidity and mortality. The Watchman FLX Pro is implanted using a percutaneous, minimally invasive procedure via femoral venous access, advanced through the inferior vena cava and transeptal puncture into the left atrium. Under fluoroscopic and endocardiographic guidance, the left atrial appendage is measured and the device is positioned, deployed, and tested for stability and seal integrity. Its engineering design incorporates flexible nitinol struts, anchoring barbs, and full recapture capability, enhancing comfort, mobility, stability, and sealing. Within 45 days, the device endothelializes, forming a permanent barrier that prevents thrombus escape. Patients receive short-term anticoagulation during and follow-up imaging ensures proper seating. The Watchman device marks a major breakthrough in stroke prevention for patients with NVAF, offering the first device-based alternative to long-term anticoagulation following its FDA approval in 2015. The original Watchman introduced a rounded atraumatic frame and recapture capability, improving safety and sealing. The Watchman FLX Pro introduced a hemocoat thromboresistant coating to reduce inflammation and speed up endothelialization, while new radiopac markers enhance placement position and a larger size option allows treatment of larger appendages. Together, these iterations represent over 2 decades of innovation. While the device demonstrates strong overall safety, a 2025 FDA safety advisory identified a rare but serious risk of air embolism during implantation, which occurs if air enters the left atrium through inadequately flushed or sealed delivery sheaths. As of July 2025, there had been 120 serious injuries and 17 deaths reported. The issue is procedural, not device-related, post-implantation, and Boston Scientific has since updated its instructions and clinician training to mitigate this risk. Other complications, including pericardial effusion, perforation, and device-related thrombosis, remain uncommon, with incidence rates below 1%.
An ethical dilemma that can arise from the Watchman is informed consent. Whilst rare, full disclosure of all associated adverse effects should be provided to the patient before proceeding. This is the very large list of adverse effects on the left, emphasized by very small writing. Notable risks include device fracture, thrombosis, and potentially death. Another ethical dilemma is financial inequality. Like the majority of medical devices, the Watchman FLX is expensive, and this can lead to disparities in accessibility amongst socioeconomic groups. What is the cost to the patients? Some data that was sourced from a recent 2025 journal article indicate that the median cost of Watchman FLX implantation costs $24,500 USD, which would be about 37,000 AUD. Whilst this is steep, the device is eligible for Medicare coverage. Note this is the US version, and this dramatically reduces costs. As of 2025, the total maximum estimated out-of-pocket costs equates to about 3,300 USD or 5,000 AUD. At this stage, the Watchman FLX is registered in 75 countries and is commercially available in the United States and most European countries. Where they have universal health insurance schemes such as Australia, the device could be accessible for the majority of the affected population, but if not, it's likely to be inaccessible to a low-resource demographic. There seems to be some opposition to the device's use in India so far, and doctors are only using it as a last resort, which is due to the procedure's expense, associated adverse events, and complexity.
The Watchman FLX Pro has been welcomed as a major step forward in stroke prevention for atrial fibrillation. Patients increasingly view it as a safer, one-time alternative to lifelong anticoagulants, while clinicians appreciate its improved safety profile. Its new Hemocoat fluoropolymer surface enhances blood capability and healing, addressing early concerns about clot formation and promoting greater trust in device-based care. Across cardiology centers, adoption has been rapid. Data from the Surpass Pro registry, including more than 21,000 participants, reported a 97% implant success rate, a 0.2% stroke rate, and only a 0.4% pericardial effusion requiring intervention, demonstrating excellent real-world safety and reliability. Emerging AI-guided imaging, personalized catheter navigation, and remote follow-up monitoring are expected to improve procedural precision and expand accessibility in lower resource regions, supporting more equitable global cardiac care. Ultimately, the FLX Pro represents how continuous innovation, combining engineering precision with compassionate medicine, is transforming community confidence in cardiac devices and improving long-term quality of life for patients with atrial fibrillation worldwide. Wrapping up, thank you all for watching and listening to our presentation on this remarkable device, one that truly represents the future of medical innovation, patient-centered care, and the advancing field of medical devices and diagnostics.